I started to have fibroids in my early 30s. Of course, they were smaller, and at that point, there was just one or two. As I got older, the fibroid got larger, and as I got more fibroids, the pain started.
I met Maggie the first time during our COVID pandemic. I was working in the emergency room, and I was called in to see her due to her severe anemia. Maggie complained that she was having syncopal episodes, she was passing out, she was anemic, and she was there to get a transfusion. During the evaluation of her anemia, it was found out she had some fibroids, and that's probably the primary cause of her symptoms.
I had a lot of pain in my lower back, a lot of cramping, excessive bleeding. I had an accident where I started to bleed heavily and nonstop. That's when I met Dr. Khamvongsa. So he stabilized me, and he did mention the new Acessa procedure. And I researched it, and it turns out that a friend of mine's niece had the same procedure. So I went in again to follow up. I said, no, I want the Acessa.
I explained to her that it's a minimally outpatient procedure where we go through the belly button. We put a camera, a second small half-an-inch incision where we put an ultrasound, and we're able to visualize every single fibroid that she has in the abdominal cavity. A needle is the one that then is going to treat each individual fibroid with energy and heat. With that heat, we're destroying that fibroid. Within a period of 3 months to a year, the patient will see a great significance in the decrease of the volume of the uterus, hence minimizing the symptoms that brought her into the office in the first place.
I woke up, you had a little bit of pain and discomfort, went home, went to bed, and I think that was the first night I had some sleep. I had no more pain. I was less weak, less bleeding. I was very surprised. I was just astonished. I didn't believe it. And he told me, I'm gonna get your life back to where you were 10 years ago, 15 years ago. And he sure did.
There are other alternatives that a woman can have to treat her symptomatic fibroids. And those, people that have back pain, anemia, heavy bleeding, pelvic pressure, incontinence, constipation, multiple things, because fibroids can cause all that, can certainly be improving greatly with a very simple outpatient procedure.
So when I speak to other women, colleagues, friends, even relatives about my situation when they tell me they have fibroids, I said, you have options.